Well, welcome to all of our participants. The program we're going to present tonight is Marketing Your Infection Control Protocols During COVID-19. My name is Mary Gavoni, and I will be presenting this program for you. My background is in dental assisting and dental hygiene. I have also been a dental hygiene educator and the owner of a temporary staffing service, which actually is what got me interested in regulatory compliance, OSHA, and so forth. And I've been doing this, I've been working in dentistry for 48 years this year and doing compliance consulting and teaching infection prevention for about 27 years. So not my first rodeo, but I will say this is the first scenario that I've experienced in dentistry that has been so overwhelmingly or has so overwhelmingly affected so many practices. And so I know that many of you are getting back to work and kind of picking up the pieces, and hopefully you'll pick up some good tips in this program that will help you to be on the road to recovery in your practice. First and foremost, we want to thank our sponsors. Although many continuing education programs are brought to you as a participant at no cost to you, it does not come without a cost. And so we appreciate the support of our sponsors. We have two this evening, SciCan and Cranberry. And we thank SciCan for helping to sponsor this exclusive webinar. SciCan is known in the industry, has been known in the industry for a very long time as the infection control specialists. SciCan provides infection control solutions worldwide for any size dental practice. They are known as the maker of the Statim cassette autoclave, the fastest cassette autoclave on the market. SciCan's global network of infection control experts develop real-world solutions based on cutting-edge technology, effective workflow, and sound ergonomics, making for better and safer patient care. From the largest multi-office practice to the smallest clinic, SciCan provides products that are used to carefully and efficiently clean, disinfect, and sterilize instruments to fight the spread of diseases like COVID-19, hepatitis B, hepatitis C, and HIV. And most of you out there who've been working in dentistry for any amount of time are familiar with Optum 1, Optum 33, the Hydrum instrument washer, and the newest member of the family, so to speak, the StatClave. And primarily, I think SciCan has been known in dentistry for the Statim sterilizer. Who doesn't love their Statim, especially for handpieces? Thank you to SciCan. And thank you also to Cranberry for helping to sponsor this webinar. Since 1988, Cranberry has specialized in the development, manufacturing, and distribution of protective infection control solutions, placing utmost importance on superior quality, protection, comfort, and strength. Cranberry has established itself as a leader in the dental industry with its stellar line of premium gloves, masks, and rubber dams. And of course, rubber dams are becoming popular again because it's a great way to control aerosol. Through years of successful global partnerships, Cranberry products are available in almost every country across the world and is proud to have become a member of the world's most trusted brands, in the protective infection control space. So again, thank you, Cranberry, and thank you, SciCan, for sponsoring our program. Many of you, as I said before, are just kind of getting back into the swing of things in your practice, and marketing probably hasn't been at the forefront of what you've been thinking about, because I know so many people have spent so much time trying to secure PPE. And that is sort of been an all-encompassing thing. So we spend our time there, but we don't think about how do we message this to our patients? How do we make our patients feel confident about what we're doing and for them to want to come back and have their dental care and their procedures completed. But marketing is key to recovering the lost revenue while your practice was closed down. So we need to market to our existing patients to know what's different now than it was before. And then we need to have messaging out there that speaks to new patients. Why would they come to us? Besides our clinical expertise, why would they come to us and feel that we're going to keep them safe when they come? And everybody needs to keep in mind, we are still in the middle of the pandemic. The scary news that's been playing all day today is that the number of cases are increasing and the number of hospitalizations are increasing. So we may start to see hospital healthcare overwhelmed again because of folks with serious COVID infections. So all the more reason why we need to be making sure that we're sending a consistent message to our patients and that we are consistently following the protocols that we should. So all along in this whole pandemic experience, what's been playing in my head is that history is repeating itself, and on a much more magnified level than before, when we had in the mid 80s to early 1990s, the HIV epidemic, when the number of cases was increasing exponentially and people were dying at very, very high rates. And when we didn't know everything about the HIV virus and we didn't know everything about AIDS, which was the next phase of an HIV infection, and we didn't have medications, and we still don't have a vaccine. So as I've said to many people, I'm thankful that we did not have social media platforms at that time, so that we didn't have the case that is portrayed here on the cover of People magazine. We didn't have it portrayed out in social media. There hasn't really been much bad publicity about dentistry and safety in dentistry on social media, although there have been some concerns. But nonetheless, that doesn't mean that we don't have patients out there that are fearful and that are not going to be asking us questions when they come in. So our job as we reopen practices and we ramp up our appointment schedules slowly, hopefully, is having this balance between trust and fear, and perhaps even skewing the balance for higher trust and lower fear. But we can't take for granted that just because somebody's been our patient for a long time that they're automatically going to trust us. So my message for a very long time has always been incorporate safety into your brand identity. Who you are is not just about excellence in care, excellence in customer service, and high tech, being at the forefront of leading edge technology. It's also about doing it in a safe manner, that somebody is not going to come to our practice for treatment and leave with the gift of some kind of an infectious disease. So that has to be, especially now, it has to be part of our brand. So what I'm going to recommend in this program is that we examine these 4 questions, and we'll take a dive into each one of them individually. First and foremost, you need to ask yourself, are you really following all the IPEC, infection prevention and control? IPEC is the new acronym. Are we following all the standards and guidelines? Now, having said that, I do understand there's a bit of confusion over who says we have to do this and who says we have to do something different. But I think we have more consistency now with updated guidance from the CDC. So stay tuned, we're going to address that a bit. Then we need to look at what kind of a statement our facility and the team make to patients, because who we are, what we do, speaks to our patients, and hopefully it speaks to safety in our practice, and our patients feel secure that they can come and be treated and not get infected with COVID, but also not get infected with another transmissible disease. And then how do we convey our safety message to our patients? Not just safety in general, but what have we done that's different? Because some of you are considering or have already implemented an infection prevention and control fee, or a PPE fee, whatever you call it. And so patients need to see what is tangible to them as different. What are we doing that's different that requires us to pay more money for our dental care? So let's start out by keeping in mind that if you are not walking your talk, in other words, if you tell your patients that you are following all the CDC, all the OSHA guidelines, but you're not, then perhaps little Pinocchio knows for you. And don't be so sure that patients don't know what those guidelines are, because all that information is out and available on the internet, and they may be questioning you when they come in for appointments. So we need to be consistent. As I said before, we need to be walking the talk. So I am not going to go into all kinds of detail about what all these standards say. What I want you to do is have an appreciation for all of the standards from OSHA, all the guidelines from CDC that we need to be following at this point. So this is the list, and probably the one that you are not as familiar with is the respiratory protection standard. And this is what talks about N95 respirators and fit testing of N95 respirators, and having a respiratory protection plan, a written plan for your practice. So those are the things you need to be in compliance with. And here is the laundry list of the CDC guidelines that we need to be in compliance with. So the general guidelines from 2003, which is the second one on the list, is our sort of Bible for infection prevention in dental practices. And then the latest guidance that we have is interim infection prevention and control guidance for the COVID-19 response. And then the most recent one is the reopening guidance for dental settings. And keep in mind that these last two, the interim guidance, is most likely going to be in force for a while, but not forever. And so people who are freaking out about the recommendation for changing gowns after every patient to prevent cross-contamination are not wanting to comply at all, but we should be during this pandemic, and because we know that this virus is very contagious, but it isn't most likely going to be forever. It's temporary. We're still in this special situation, if you will. Then the last thing you need to be considering in terms of infection prevention and control standards and guidelines is, what does your state dental board say that you need to do? And this link is to the American Dental Association website that has compiled a complete list of all the state dental board addresses and contact information. So you can click on the links on the ADA website, and you can go to your state dental board website and you can get a copy of the rules. Many state dental boards, as I've been reviewing these for clients that I'm consulting with, have actually special COVID information pages and directives. Now, I know that there are many of you out there that are thinking, well, you know, what is it that I really have to do, and what is it that's recommended? And here's the deal. You must comply with OSHA rules. Well, you should comply with OSHA rules. If you don't, there are consequences, okay? If you're inspected, if you're reported to OSHA and you don't, you can be inspected and you can be fined. Compliance with CDC guidelines is not a law in and of itself. CDC is not a regulatory agency. However, they do set standards of care. And so state dental boards, and that's why you need to check your state dental board, make sure that you know what the language says in the rules, because many state dental boards say that you must follow. It's required that you follow CDC guidelines and guidance. So in that way, they do have the force of law, because there could be disciplinary action against your dental license, dental hygiene license, dental assisting license, if you aren't following those particular guidelines. And the other thing to keep in mind is, even though we have no evidence at this point that there have been COVID transmissions in dental practices from patient to patient, or healthcare worker to patient, or patient to healthcare worker, if there's any kind of litigation that goes on, if something does happen and it's found that you're not following the standards of care, then there certainly is some liability to a practice. And that could be worse than having to try to figure out how to be in compliance. It could be disastrous if a practice gets closed down. So enough about standards. Now we're going to go back to marketing. Marketing 101, you are your brand. So who you are, what you represent, how you look and talk and act are all representing your dental practice. And the facility and the team are two things we're going to look at, because they are part of the brand, and hopefully in a positive way, part of your infection prevention and control message that you send to patients. So hopefully no one has cluttered, unkept looking equipment or rooms in their facilities. Hopefully while you were closed down, everybody spent some time decluttering and cleaning things up, because what your facility needs to say about you, it needs to scream clean, organized, uncluttered, aseptic. It doesn't have to be opulent. It doesn't have to be brand new. It doesn't have to be expensively decorated, but it needs to be clean and uncluttered, easy to decontaminate, because any of the clutter that's out on countertops, on shelves, not in cabinets, not in drawers, in a treatment room during patient care, must be decontaminated, because we know that it's going to be potentially contaminated by aerosol spatter or splatter. So hopefully we get things out of off the countertops. Back in the HIV epidemic, there were a lot of recommendations from speakers and infection control experts who told teams to take their patients on a tour of the instrument sterilization area. Show your patients how you heat sterilize instruments and what you do and how you keep them clean and organized. And I have recommended that for a long time, except if your sterilization area isn't clean and uncluttered, don't show it. Don't go there, because that will not make your patients feel confident. And I think in practices that have been in existence for a while and have some older facilities that have maybe laminate countertops, where some of the chemical sterilants and the disinfectants and other liquids we've used for various processes over the years have taken their toll and delaminated some of the countertops, and things get stained up and all those things. Do not show those to your patients. But if you have a beautiful, pristine, uncluttered sterilization area, then by all means, let your patients see it, or take pictures and put it on your website so that patients know that you are really, truly trying to do the very best that you can. And a lot of people have said that, well, this is not a big deal. We have been doing good infection control all along, so we don't really have to change much. But I don't know that that's true for everyone, okay? Now, here's a picture that I would say is clean, looks relatively uncluttered, looks pretty aseptic to me. I would feel, if I were the patient, pretty confident coming into this treatment room. But there's one thing that I think many people have gotten a little bit lax about, and I want to make a specific point because this is part of the facility and this is part of your work practices. The thing that I would change in this picture is not having instruments out and open on a tray until my patient is in the chair. Patients want to know that you are taking out those instruments from those packages or unwrapping a cassette so they can feel reassured that those instruments have been sterilized and not used before. And a lot of people, in their quest for efficiency, will set the rooms up way ahead of time. And right now, when we're still concerned about the aerosol transmission of COVID, we absolutely should not be doing that. So keep your instruments in the pouches, in the cassettes, wrapped until the patient's in the room, and unwrap them, open them in front of the patient. Easy thing to do. And it doesn't take that much time to set up. So now let's talk a little bit about the team. How does your team represent your brand? Do you have a clearly defined culture of excellence in care, excellence in service, and excellence in infection prevention? Anybody should be able to visit your practice and know if that's true or not. Now, if you're not really sure about what it is to define or develop a culture in your practice, here's a couple of resources for you. The two resources on either side, the right and the left side, are books that are directed to any type of business. And they're fabulous for gleaning information that you can use in your practice. I love both of them. I use them when I work with teams. But we also have an amazing expert within our industry, and many of you know her, Judy K. Mossoff, my dear friend, who has written a number of books. If you go to her website, judykmossoff.com, she has these books available on culture, and Judy K. does culture camps where she enables practices to define and refine their culture in their practice. And I think right now we've been given a fabulous opportunity for a reset or a do-over, and let's take advantage of it. Create that culture, make sure that you stand out, that everyone in your practice feels so confident, whether it's the team members or whether it's the patients, feel very confident in what you do to keep them safe. So the ways the team represents the brand, besides being part of this culture within a practice, have to do, of course, with verbal communication. How do we talk to patients? What do we say? Do we use the right words? More important than that, though, is nonverbal communication. Do we make a big deal? Oh my gosh, I have to put on all this PPE and I'm hot and I can't breathe. You know what? The patients don't care a lot. I mean, they don't want you to pass out because you're too hot, but they don't really want to hear how uncomfortable you are in all your PPE. They want to know that they're safe. So we have to be careful about our body language. And what about appearance and grooming? Now, just because we're wearing all this PPE doesn't mean we dress up in wrinkled scrubs that sat in the dryer all night and then we just put a gown over them, because you can still see that the pants are wrinkled. We don't want to have dirty shoes. And what about hair? If we are wearing hair covers, we don't want to have hair kind of sticking out that looks a little scary. I call it the bedhead look. We don't want to show up that way for work. Nobody really does that much in corporate America either, so we need to be careful about those things. And we need to be consistent in our message so that everyone on the team is saying the same things to the patients about how important it is for pre-screening, why it's important that everybody has their temperature taken and washes their hands when they come in the office. So no one should be poo-pooing it and saying, oh yeah, I think it's overkill, or oh, you know, it's just a little bit of flu, it's not a big deal. It is more than flu, it is a big deal. So we all have to be on point about those types of things. So once we get a culture established and we look at how we're identifying and representing ourselves, then we need to develop methods for communicating the message to our patients. And we communicate now in so many ways. It used to be that we communicated live and in person when our patients came into the office, and we communicated with them by phone, but now a lot of our communication is electronic. So if you do not have a website for your practice, that is a must. The marketing experts say that that is now the most common way that patients find us, that new patients find us. Yes, we know that personal referrals are important, but the number one way, according to the marketing experts, is they find us on the web. And even if a patient has a personal referral, I say to my neighbor who asks me, you know, do you know a good dentist here? And I say, oh yes, go see this doctor, and give them the contact information. Most likely my neighbor is still going to go on the web and check that dental practice out. So if you have an existing website, then I think it's time perhaps to give it an overhaul. Again, this is about resetting. Make sure that you are participating in and utilizing social media channels. That's where most people go, and it's not just the millennials, it's pretty much everyone across the board now. What about scheduling and confirmation? What is our message there? What's our message on our voicemail? What about a message on hold that can talk about how our dedication to safety sets us apart from other practices, because these are all the things that we do? And then how are we communicating our message about our practice in the community that we live in? Because that's just as important. So I said earlier that I think it's time for a reset or maybe a redesign on your website. It doesn't have to be something extensive, but at least have a tab or a page on your website for infection prevention and control. I'm not sure that I would use that more technical acronym of IPAC. I would say patient safety, or just infection control, or even better, infection prevention. Have a page that you can design, that you can put pictures, videos, all types of information about what you do. Show that sterilization area when it's all cleaned up and decluttered. Show your treatment rooms. Have you installed air filtration devices in your treatment rooms that patients may want to see and know about? What other kinds of safety equipment are you using? I have seen some fabulous pictures on Facebook posts of teams who have put on all their PPE, and you know, they do a happy dance, or they do something cute and funny to let patients know what they're going to look like when they come in. You know, you might not recognize me when you come in, but this is me with all my PPE. Give patients a virtual tour. You can do a video with your cell phone and you can upload it to your website. There's so many things that you can do that are visual for people to see. You can also load your pre-screening questionnaires for patients, the medical questionnaires for those patients to access on your website. And you can utilize some of the services out there that are available through either Dentrix or EagleSoft, Revenue Well, any of those, Curve Dental, all those companies that will allow you to have electronic forms, and patients can fill them out and they can be uploaded back to a portal where you can have access to them. That saves you from having to mail out forms or asking patients to bring back paper forms. We don't want to be handling a lot of paper right now. So use your electronic media to do that. And one of the things we've been talking about in dentistry for a while, probably the last 5 or 6 years, and it's now really, I think, coming into its own, which is designate someone who is the infection prevention and control coordinator in your practice so they can answer questions. They're the go-to person. If a patient has a question or they have a need or they don't know what to do about whether they should come in for an appointment or not, have a specialist on your team who can do that. Introduce them on your website or in social media. I have told many of the practices I work with that they should create an email address that's separate. It's part of your office email, part of your web mail, but it's an email link to that person so that they can go in and check messages. You can send out specific information that comes from that infection control coordinator. And I've mentioned before on several webinars that if you go to OSAP, the Organization for Safety, Asepsis, and Prevention, or the Dental Assisting National Board, you can find out about becoming a certified infection control coordinator. And I think that's a great asset for a practice to have that ability to do that. So much you can do on your website. Get patient testimonials, whether it's written or it's video, get their permission to publish them, have the team write testimonials or record testimonials about how safe they believe that their patients are when they come into the practice, and detail all the things that you're doing. I think every dental practice ought to have their own YouTube channel where you can put all types of videos there that you link to your website. They can be about restorative procedures, they can be about preventive care, they can be about oral systemic health, and of course, infection prevention. Take advantage of your software programs that you subscribe to do online surveys. Make sure that you are meeting the needs of your patients, and take advantage of online reviews as well. So electronic communication with your patients is golden, and much of it you can manage yourselves, or you can outsource it if you choose to. And as I said before, social media, so very important here. I would have several social media apps or channels that you work with from your practice because you want to hit all the demographic groups. Facebook is said to be by some people for the baby boomers and some of the older folks, but you still get all kinds of people there. Instagram, LinkedIn, I mentioned the YouTube channel. You should be doing tweets about your practice, all of those things. So again, you can outsource it to someone to do posts for you, or you can subscribe to apps like Hootsuite, for example, that you can schedule it ahead of time. You can spend some time putting all the things together and then schedule it to be posted in the future. But keep it up to date. Take down old posts, or make sure that you replace some information that's there that's now out of date. Keep in mind that video is very effective and it's very engaging, and many people get more hits on their social media pages when they have live video or when they have recorded video. So an Instagram or a Facebook Live, whatever works best. And keep in mind too, that if you do some of these things with a sense of humor, you make it funny, then it's more memorable to your patients. But we also have to have some degree of seriousness because it's a serious topic. But engage in social media. Keep your patients up to date. These are 2 YouTube videos that I would encourage you to go take a look at that have great messages about coming back to work and what things are going to be like when you see patients again. I've just kind of randomly chosen them from some of the research I've been doing online for recommendations for my clients, but I think you'll like them. One is Tooth Talk girl who's very active on Instagram and social media. So you may recognize her in the video. So I encourage you to take a look at those. But be creative, do your own thing. I have just seen so much incredible information out there that I think this has brought out our creative side, having a little bit more time to do things. So then we need to look at what are we doing for scheduling and how are we confirming, because we have to now do this pre-screening and we have to explain to patients that if they have some respiratory symptoms, we're not going to see them for a while. So I recommend that you create scripts. How do you want to say this to these patients? And everybody has to give the same message, because what can happen is patients get to know you. And if you have more than one person working in the business office and a patient perceives that perhaps Sue is a little more lenient than Leslie, then perhaps if I get Leslie on the phone and she says, no, you have to do this, this, and this, well, I'll call back and see if I can get, or I'll request Sue, and Sue will kind of let things slide. Then we start losing our consistency with our protocols. So make sure that everybody's on the same page, they're confident, they know what to say it, how to address objections from patients, because you know you will get them. There are some patients that don't take this pandemic seriously, and they will say, you know, I just have a cough. It's not a big deal. You have PPE, you have face masks on, so what? And that's the old school thinking. We used to say that to patients. Don't worry about it. Come on in. We've got our PPE. Not now, not in the pandemic, and perhaps not in the future as well. If you have new patients calling to schedule, direct them to your website so they can see what your infection prevention and control strategies are. What do you do to protect them? What's expected of them? What can they expect of you? And the more you direct people to your website and the more areas that they click on, then of course that helps your search engine optimization. It helps your Google rankings and so forth. So utilize that when you're scheduling, when confirming. And remember that you need to try to get that questionnaire answered a couple of days ahead of time from your patients, so you know whether it's okay to see them or not. And then you need to reconfirm that when they come in for their appointment. And so the way to do that is, again, through technology. Use the software platforms that so many of you subscribe to, whether, again, it's through your software itself or it's another company. We have so many great companies out there with platforms that can help us to get forms transmitted to them and back to us, videos that you can post even on a mobile website, a mobile compatible website, all the things that you need patients to know. Remember that you have to wear a face mask when you come in. Remember that you should limit the number of people that you bring with you and all those things. People are so keyed in now to electronic communications, and with so many people still working from home and using web platforms like Zoom and go to webinar, go to meeting, and all those things, that they're not afraid of it so much anymore. And again, don't assume that people won't use it, because they will. Even the grandmas and grandpas in your practice, I hear so many people say in the past, oh, you know, we have so many older patients and they won't do it. Yeah, they will, especially in the last few months. They have had to communicate with their families, especially their children and grandchildren, by Zoom and by FaceTime and that. So they know how to use it and they will use it. We just need to create that expectation that it's the best way to communicate. And look at what kind of software capabilities you have for doing touchless payments. Because if you can use some type of a platform where the patient can simply check out on their phone, their credit card is linked, and it sends the payment right to you, it's awesome. I use that when I go to Costco and Sam's. I have not been through a check line in a very long time. I pull up the app, I scan all my things as I'm shopping, And when I'm done, I hit pay and it goes to my debit or my credit card. And all I have to do is show the code on my phone as I walk out the door. We should be able, and we can do those same things in dentistry. And then we don't have to be touching papers and credit cards and those types of things that can cause infectious disease transmissions. Utilize teledentistry. Oh, what an amazing gift. What an amazing platform. It has to be HIPAA secure, of course, for privacy, but being able to screen patients ahead of time. If someone has a concern or a question, they don't know whether they need to come in or not, we can, with a webcam and a microphone, we can have a conversation with them. It's very personalized for the patient, and it gives us so much more information than just that two-way phone conversation. I hope that we continue to use this beyond the pandemic, because I think it has amazing application for a number of things. I would love to see follow-up for complex cases where we actually have a video chat with a patient that evening and how did they do? Or what about patients in periotherapy? They started their scaling and root planing, and we can communicate with them shortly after to see how they're doing and are they having any issues. If we gave them some a rinse or a mechanical brush or something to work. How's it going? Show me what kind of issues you're having. I think it just has huge application for us in dentistry. Now, some of the diagnostic visits can be billed to the patient and to the insurance companies, but certainly follow-up visits should not be. But wow, what a way to market your practice with such a personalized visit with a patient post-treatment or pre-treatment. Let's have a teledentistry video chat so you can meet me before you come in. Hi, I'm your new hygienist. Can't wait to see you. I can't say enough good things about teledentistry. I think it's awesome. So then let's go back to something not as high-tech, the phone system. So can we put a safety message on our voicemail, assuring patients about our procedures? This is what's going to be different. We can't wait for you to come in and meet Mary, who's our new infection control coordinator. Call Mary if you have questions ahead of your appointment. And what about a message on hold? There are many services that will do that for you, and you can put all that kind of information on there as well. What a great way to market. And then I think the community activity marketing piece of this is also very, very, very important. Many practices, many of you listening probably donated, much to your chagrin now, your PPE to the hospitals. Hopefully you let your patients know that you did that. And it doesn't mean that you're bragging about it. It just means that you're doing your part to help out. But what about working with food banks and other services that, we wear our t-shirts that say, Mary's Dental Practice, and so they know who we are and where we're from. And another thing that I've seen in the area where I live is one of the churches, many of the churches have food banks, but one of the churches in my area has a personal hygiene pantry, so people can go and get personal hygiene products, personal care products, and oral hygiene products are of course part of that. Why not do something like that? If you didn't give out toothbrushes to any patients for the last 6 weeks, what if you can donate some of those to a group that could utilize them? And we still have so many people who are unemployed, maybe permanently laid off from their job, that are in need of those things. So that's an outreach thing that we can do. And partnering with medical practices to promote oral health as part of systemic health. So we don't want patients to stay away from the dental practice, and we can let those medical practices know that we're making things safe for them. So we're going to finish up with a discussion about whether or not you should charge an infection prevention and control fee. I personally don't think it's a good idea, but that's my personal opinion. And I don't look badly on anybody who decides to do it. If you're going to do it, I would make it reasonable. I've heard some webinar presenters say it should be $45 or $50. And my personal opinion, I don't know that that's appropriate or even affordable for some patients who, again, aren't working, are permanently laid off. But we all know that we have respirators to buy that are not inexpensive, gowns that need to be changed after every patient. Perhaps we're wearing hair coverings and shoe coverings, and those are the new sort of things. The regular things that we wore before, gloves and masks and gowns, have all gone up tremendously in price. And we don't know if that's ever going to come back down to the pre-COVID pandemic prices that we had before. And then we have air purification and filtration that we need to think about in our treatment rooms to control the aerosol, and HVE devices for everyone, including the hygienists. So I guess what I would say is it's up to you and up to every individual practice to decide how they want to handle it. You know your patients better than anyone. If you decide to charge, then I would certainly make it reasonable, but I would also make sure that you charge everyone, because you can't charge some people and not others. You must charge everyone. I think somehow we lost our slides, maybe not. Okay, so should you charge a fee? Here's a pro and con list. This is the thing that always works well. Certainly it helps recover the cost, and we know we have increased costs. If you charge it out and you bill it to insurance plans, it makes them aware that there is this cost, that they should look at that. But the thing to remember about insurance benefit plans is this: new services cannot typically be added to a program or to a plan during a particular contract time. So even if we want the insurance companies to do that right now, they may be limited in what they can do because of their contracts, and they have to get the subscribers, the companies they sell these contracts to agree to that. So it does make, if we're charging for it, it does make it more tangible to our patients. But on the other hand, it could be a burden, and it may make patients angry. They may not like it. They may think it's just an inherent part of what we do. So you have to decide. You have to weigh the pros and cons and decide what works. So what should the fee be? How do you calculate it? What do you quantify? Well, certainly look at the unit cost of a mask or a respirator, a gown, gloves, face shield, hair coverings, shoe coverings, and then calculate out if we're using one respirator per patient, one gown per patient, maybe several pair of gloves. Face shields may be reusable or they may be disposable, and hair coverings, shoe coverings are typically disposable. So how much does that cost? And it's probably going to be somewhere around $25 or somewhere in that vicinity, depending on your buying power and all of those things. Don't know what your specific cost would be, but you can do that cost analysis. And then we have to look at our equipment. Did we have to make modifications to our HVAC system? Did we buy purifiers for each room? Do we have HVE devices for every operatory now, or additional ones, and thermometers to take temperatures? And of course, because we're going to be running a lot more things, air purifiers and so forth, we're going to have increased utility costs as well. So that cost, you're going to have to figure out the total cost of that and then amortize that per patient. So your accountant might be able to help you figure that out, or if you're a math whiz, you may like to do that calculation and see if that works for you. So in closing, what I would say is go back to the tried and true SWOT analysis. Let's look at our practice in terms of branding and infection prevention and control, in terms of our strengths. What are we really good at? What are we communicating well? What are our weaknesses? What aren't we communicating as well to our patients? Where do we have opportunities? And what are the threats? Are the cases of COVID increasing in our area? Are patients not wanting to come back in because they're afraid? Take some time and think this through and see what it is that will help you to market your practice in a very positive way. So in conclusion, I want to thank our sponsors again, and SciCan, of course, we thank for their sponsorship, and remember that they are our infection control specialists in terms of sterilizers and instrument washers and disinfectants. And Cranberry is beloved, I know, in the dental industry for gloves and for respiratory protection. So thank you again to our sponsors for your help and support of this program. So we are going to get ready to do questions and answers, and I thank you all for your participation. Okay, so first question is, what are the recommendations in regard to reusing N95 masks? I've heard placing in paper bags for a certain amount of time. How long can they be reused for? We are only allowed to reuse N95 respirators right now because they are disposable, but right now, because we're under emergency use authorizations by the FDA, and we're allowed to reuse them because of supply crisis. And as we see hospitals, again, more hospitalizations occurring for COVID patients, then more of those masks may be getting sent to the hospitals and less to us, not masks, respirators. So you are allowed to reuse them, but the CDC says in the ideal world, you should only use one for a work shift. So one a day, but I don't know if that's possible in your area, if the supplies are there or not. We simply don't know. So if you don't have N95 respirators, then you may have access to KN95 masks. We've heard lots about those. And OSHA and the CDC will say, in the absence of an N95 respirator, you can wear a face shield and a level 3 surgical mask. So it's not good enough just to say, well, I can't get N95, so I'm not going to wear them. Okay, you need to be checking with your suppliers. You need to make sure that you're checking enough suppliers to see if you can get some that are available to you. And you also should be documenting that you're trying to get them, because OSHA wants us to be wearing them, but they do understand that there's a shortage. So if you did get inspected and you weren't wearing N95 respirators doing aerosol generating procedures, you would have to prove to an OSHA inspector that you had made every effort you could to try to secure them, and not just say, well, you know, I know I couldn't get them for a long time and so I haven't tried anymore. They won't accept that. Now, whether it's acceptable to put it in a paper bag and store it for a period of time, I don't know that I've seen anything in CDC guidance that says that that's okay. There are some people that say that you can store them and wait 3 days and wear them again because the virus is going to die. The thing about reusing them is you may be degrading the seal on your face, and then it's not going to protect you. And the elastic straps, there's 2 elastic straps, and those will only hold up to so many times putting them on and taking them off. So you have to use your best judgment, and there is no specific time frame other than the CDC says 1 shift would be the best. Do we think it's safe to travel now or not really? I think that depends on the area that you live in and the area that you are wanting to travel to. Someone states that they're pregnant and concerned about aerosols while only doing hand scaling. Our dental practice will be using KN95 instead of N95, and it doesn't provide a good seal. Should I be concerned? Well, you absolutely should be wearing a face shield, whether you have a level 3 or a KN95, and even with an N95, because then you can protect your N95 from getting contaminated. You should always talk to your physician to see what they recommend if you're pregnant. Hand scaling is, I know that the fear of every hygienist that hand scaling is going to be the requirement from now on, but I think once we're past the pandemic, ultrasonic scaling will be allowed again. And if you have an N95 respirator and you have a face shield and you have good HVE suction, you have an assistant, and then you can use your personal judgment whether you should use an ultrasonic scaler or not. But the aerosol that you're going to produce other than ultrasonic scaling, you're not going to be producing aerosols with hand scaling, maybe some limited amount with polishing and a limited amount with an air water syringe. So I think there are ways to look at that and make it safe for your situation, but absolutely talk to your physician. Are hygienists just as liable as dentists? Yes. Any licensed dental professional can have liability. The most liability, if something goes wrong, will fall on to the dentist, the practice owner, but it can fall on the assistants and the hygienist as well if they're licensed by a state. I think that, and I like this statement. A lot of businesses are charging PPE fee, including hair and nail salons, car repair shops charge for supplies. That, you know, there's a lot of rationale there for charging, and my opinion is that I don't know that we should, or if we do, it's minimal, but that's up to each individual practice in your philosophy whether you should or not. Question about face shields. Should they be wiped after patients are disposed of? And it depends on what type of face shield you have. If you buy it as a disposable shield, then yes, it should be disposed of after every patient, but they're less expensive. They're kind of flimsy. And I don't mean that in a bad way. They're thinner plastic. If you have a reusable shield, then you should be cleaning it and disinfecting it after every patient, but do not disinfect it with your surface disinfectant. Wash it with soap and water first, and then disinfect it with alcohol, because it will make it spot free and it won't degrade the plastic. Someone mentioned that they take their, I'm assuming it's N95 masks, to the hospital to be sterilized through UV light, and that's acceptable if it's an FDA cleared device, and the ones in the hospitals are. But again, you have to be careful that you're not exceeding the use life of that mask in terms of the quality of the seal and the integrity of the straps. Question, can you sterilize disposable gowns? Some disposable gowns can be sterilized for reuse. The second part of the question was how many times. You have to follow the manufacturer's instructions. They will tell you. Another question, is a UV sanitizer light safe since UV rays can cause skin cancer? UV sanitizers, like some of the ones you see in the nail salons that are being used for decontaminating face masks, are in most cases not FDA cleared. Therefore, they shouldn't be used in conjunction with disinfecting face masks. And you have to make sure that there is, the devices are completely enclosed so that you're not exposed to that UV light. It can cause eye damage. So we need to be careful. What is the best face mask for loops? I'm thinking perhaps that the asker of that question meant which is the best face shield for loops. And the one that I've heard the most about that is a reusable shield is the OptiOp 2. OptiOp 2, that it is well spaced so it can accommodate loops and a light. So you might want to look at that. And I think that may be all of the questions. I haven't seen any new ones in here. So I think probably many of you have had a long day, and it's time to call it a day and let you all go and enjoy the rest of your afternoon or evening, depending on where you are in the country or where you are in the world. I do want to mention one last thing for if we have any friends from Canada who are participating in the webinar, that make sure that you are up to date on what your Royal College recommends for you, what their requirements are for infection prevention and control, and also Health Canada. So thank you again for your participation, and I wish you all good luck and be safe and stay well.